Thank you for joining the webinar today, brought to you by Jones and Bartlett Learning and the National Association of Healthcare Quality. The webinar is entitled Integrating Healthcare Quality into Curriculum, NAHQ Resources for Educators. My name is Jennifer Pitts, and I'm the Vice President of Products, Programs, and Certification here at NAHQ. And I'm going to be joined a little bit later by Esther Imard, who is not only the board president, but also has experience in higher education and has integrated quality and safety into several different graduate level programs throughout her career, most recently at George Washington University. And she'll share a little bit more about herself a little bit later during the interview portion. So our learning objectives today for this session is to learn about NAHQ's mission and its role in advancing healthcare quality. I'm going to explain the CPHQ certification, including the benefits, target audience, and impact on career achievement. We're going to explore the content and structure of the HQ Solutions 5th edition and its applications in the classroom, teaching, and learning. And finally, we're going to talk about how to identify ways to integrate healthcare quality principles into the academic programs to better prepare students for future careers. So the agenda is going to be broken up in a couple different parts today. I'm going to introduce NAHQ and talk a little bit about what quality is, why it's important, and how it's achieved. I'm going to do a little deeper dive into the CPHQ program. And finally, Esther is going to come on and we're going to do an interview and talk to her about how she's integrated quality programming into the work that she has done throughout her career. So who is NAHQ? So NAHQ is the preeminent organization dedicated to professionals who work in healthcare quality and safety, defining the standards of excellence for the profession and discipline. Our mission is to set the industry standard for quality and safety and help individuals and organizations achieve it. Throughout our history, we have certified over 40,000 CPHQs. Our community includes 150,000 engaged professionals. We've worked with over 150 organizations, and we're in 45 plus countries. I'm going to explore a little bit more today about what quality is and resetting your definition of what quality can be. I'm going to talk about why quality matters and learning a little bit about the biggest challenges in healthcare quality. I'm going to talk about who is quality and maybe consider expanding your view of who should be working in quality. And finally, how quality is achieved and talking about standard setting and the work that NAHQ is doing. So what is quality? Today, too many still view quality as a very limited legacy mindset, rooted in compliance as a result of layers and layers of regulation, jumping through hoops, checking boxes, and passing tests. But at NAHQ, we view quality in a much more expansive, forward-thinking light. We believe quality means so much more, and that an expanded definition of quality is needed to improve care and reduce costs. And at NAHQ, we like to study things and we like to set standards. So that's exactly what we did. This data is from a recent study NAHQ conducted where we asked both clinical clinicians and non-clinical administrators and leaders what quality meant to them. We asked these leaders specifically, how would you define healthcare quality? And no surprise, there's no clear definition. The meaning of healthcare quality is inherently subjective and contingent upon the context, the perspectives, and the career pathway that many individuals have taken to get to quality roles and quality work throughout their career. We dug a little deeper into the data and compared clinicians, so again, those providing direct patient care, and administrators who aren't, and guess what? We know that while the definitions run the gamut, both groups' definitions tended to link back to achieving positive patient outcomes. So what we believe here at NAHQ is that quality is an important profession and a critical discipline. Quality is a driver of excellence and a reducer of costs. Quality is inextricably linked to safety. Quality is all of our responsibilities. Quality is not optional. And in fact, quality is all these things and so much more. It's one of our greatest strengths and it's one of our greatest challenges in the healthcare industry. And that's why we're on a quest here at NAHQ to redefine quality as more than just that regulatory and compliance, but instead a true driver of sustainability and healthcare excellence in order to achieve those positive patient outcomes I mentioned before. So, why does quality matter more than ever? Well, the stakes are high, and we believe it boils down to three things: care, cost, and cliff. So, healthcare delivery is changing very rapidly. There are new primary care models emerging. There's different kinds of Medicare Advantage programs coming on the scene. There's home health and telehealth implementations and innovations, and so much more. And if we've not achieved coordination, alignment, or safety in this acute care setting, which we've been working on and studying and being a part of for a really long time, and it's generally contained care, how do we think we're going to do it across a continuum of care, in an even more complex environment? Moving care to a new setting or evolving a payment model is not going to solve for these issues. The antidote to all of this complexity is quality, more safety, more equity, and more value. So, what about cost? Well, it's unsustainable. I don't think there's any more words needed. We all work in this environment, and it's very clear to us that the cost is going to continue to rise as we continue to see an overflux of Medicare beneficiaries and others come in to the field and come in to and seek care. And speaking of doing more with less, there's Cliff. The workforce worldwide will shrink by just about half in the next 15 years. So, to give you an example of this, some foundation is that in 1950, the ratio was 12 to 1. So, 12 working adults for every one retired person. Today, it's 7 to 1. So, 7 working adults to every retired person. And in 15 years, it will be 4 to 1. So the workforce cliff issue is going to affect every industry in the world, but it's going to hit healthcare particularly hard because those senior citizens will not be able to go out and buy more cars or go to Starbucks or go to Target. They're going to be coming in to buy and access healthcare. And we're going to have a lot less workforce to be able to do that work. So we have a lot of work to do with these particular challenges. Next is who is quality. So quality is everyone, right? We've heard that being said, but it's not enough to say that it's everybody's job. We've done that and we're still in the same situation. But we need to be able to align and define what skills are necessary for what roles to do quality and safety work well. When NAHQ works with organizations, the first question we ask is, who on your team does quality, or what other teams work on quality and safety projects? And most of the time we get the answer, well, we don't really know everybody that does quality. Who do you think should be doing it, NAHQ? And therein lies the problem. If you don't know who, how can you know what they should be doing or how well they're doing it? And the reason that this is an issue is because for decades, the strategy for preparing the workforce for quality and safety was on the job training. And most people came in as a second profession, right? We didn't have academic pathways for people to do and learn this work. We do have masters of programs in health administration and we also in healthcare safety that's come on in the last decade, but we still don't have a lot of individuals who are getting this information, knowledge, and skills within their undergraduate and graduate programs. So therein lies the problem. But I will say that we have some good news. People are leaning into this idea that they work in quality and safety, that they need to upskill in this important discipline. I was recently at ACHE, the Association for Healthcare Executive Conference in Houston a couple weeks ago, and there were a lot of different masters of healthcare administration and nursing and all of those, and they would come up to the booth and say, "Wow, NAHQ, like we know who you are. We recognize the great work that you're doing in healthcare quality. We want to be a part of that. We think we are already quality professionals. How can we continue to grow?" So I think there's a lot of interest and a lot of people who are seeing themselves in this work. At NAHQ, we like to say that the individuals who work in this field are more like-minded than like-type. So how is quality achieved then? So again, I mentioned that for decades, this strategy of preparing the workforce has been on the job, right? On the job training with no standard. So NAHQ developed the standard. And quite simply, we wanted to set the standard so that we could help everybody achieve it, which helped us to create the Healthcare Quality Competency Framework. It is defined by 8 domains, 29 competencies, and 486 skills required for a high functioning quality and safety organization, and really serves as that industry standard. The other thing that NAHQ does with this framework is we use it as a guide to help us for all of our programs and all of our comprehensive products, programs, and certifications. So we use this information to help us understand what people need, and we help it to drive the kinds of educational resources and programs that we put together for the industry itself. So I'm going to dive a little bit deeper into one of those programs, which is our CPHQ. It's important to mention that the CPHQ, the Certified Professional in Healthcare Quality, is accredited, and we believe, and it's the only accredited certification in healthcare quality. And we believe that holding our certification programs to this highest standards of excellence is very, very important for what we do here. And earning and keeping this accreditation is an arduous task, as many of you know, working in higher education. But again, we think it's important to ensure that the credential stays relevant and meets the highest standards of certification excellence. So a little bit more about the CPHQ. All candidates eligible are to pursue the examination and the credential. It is not required, but recommended that you have at least 2 years of experience in a quality position before sitting for the exam. And I also want to say that there are no specific requirements to sit for the exam. So, for example, you do not have to have a clinical background. That's one thing that people ask me all the time. Do I have to have a clinical background to sit for the CPHQ? And absolutely not. And in fact, there are many, many leaders and successful professionals within this field that come from a variety of backgrounds that don't have a clinical background. And many of them feel that it's important to have a mix of those types of skill sets on your team. So that's, again, a little bit about the CPHQ and the eligibility. Some of the benefits of earning and maintaining the CPHQ obviously is a commitment to continuing to improve as a professional. You'll be acquiring specialized knowledge and skills by just going through the exam preparation process. We'll talk about a little bit later about some of the additional benefits of advancing professionally, but the other thing you'll be doing is demonstrating your competency and, of course, being an advocate in advancing healthcare quality and healthcare in general. Some research, I mentioned NAHQ likes to do research. Some recent research we did when we compared both CPHQs and non-CPHQs is that CPHQs consistently report performing work at a more advanced level related to the healthcare quality competency framework than non-CPHQs, actually in all 8 domains. The research also suggests that CPHQs are doing more work that involves some more complex types of work, like leading and motivating teams, simplifying complex issues, and driving change. And those skill sets are very much in demand. CPHQs in the same research were also likely to hold higher job titles than the non-CPHQ peers. And those CPHQs also reported a broader scope of work. So performing work, again, often at 6, 7, 8 domains of the competency framework compared to those individuals who don't hold the certification. And 25% of all job postings for healthcare quality professionals and related leaders that are found on the NAHQ's Career Center in the past 12 months either require or prefer that candidates have a CPHQ credential. So it's a very highly regarded certification and credential. I mentioned there's been 40,000 people that have been certified over the last 40 years, and we have seen those numbers grow continually over the years. So it's a very valued, very well-respected credential. Just to mention that the credential, once you receive it and are successful, there is a recertification process because we believe that it's critical to retaining and demonstrating your value as a professional. So you are required to recertify every 2 years. And the requirements are that you get 30 hours of continuing education in total. And these education hours just have to align to the competency framework. So we find that many individuals who are both, who have multiple credentials, both clinical, non-clinical, they're able to find a lot of their continuing education can fit very nicely into their CPHQ recertification cycle. For anybody, both listening to this webinar, for any of the professors or adjunct assistant professors, if you're looking to get to CPHQ yourself, there's a candidate handbook and outline on our website, nahq.org/handbook. And there's lots of resources and information about how to register and schedule and all kinds of different things on our website. I also want to mention too that NAHQ does produce our prep products, and they're designed to support those who are planning to take the CPHQ examination. All of these products are based on the most current version of the content outline, and we deliver them in a variety of formats available from self-study to virtual live, which again, Esther will mention here in a little bit in our interview how she's integrated some of these materials into her curriculum. The other very important resource that I want to point out today is the HQ Solutions book. It is the book that we partner with Jones and Bartlett Learning to produce this book. It's a comprehensive coverage of quality and safety. It aligns with the 8 domains of the framework and really supports a full spectrum of quality work. It's got practical tools. It includes real-world examples, templates, and strategies. And like I mentioned before, it's really the authoritative resource. It has been developed and by industry experts, making it really a trusted foundational textbook. Whether you are studying for the exam or not, many people use this as a desk reference and continue to use it as a source throughout their career. I would also like to mention that with our partnership with Jones and Bartlett Learning, there is special student value pricing right now. And you can learn more about this when you go to jbllearning.com/NAHQ, or you can contact your JBL account manager to arrange for the special student value pricing. Well, that is it for the first couple parts of the webinar. I am going to now invite Esther to come on, and we're going to do an interview together. So Esther, thank you for joining us today. Would love for you to maybe tell the audience a little bit more about yourself and your background in academics before we get into the interview questions.
Jen, thank you so much for the opportunity. Let's see, excuse me, for the past 11 years, I've had the pleasure and privilege to be faculty at George Washington University, primarily in the School of Nursing, though I've also had an adjunct appointment in the School of Medicine, Health Science. I've developed many courses on healthcare quality and patient safety on the graduate level, and I've also served as faculty for many of them. Previous to my career in academia, I've also was one of the 3 main educators for the QSIN initiative, which was Quality and Safety Education in Nursing, where the 3 of us literally traveled the country meeting with faculty, talking about the knowledge, skills, and attitudes related to advancing healthcare quality and patient safety. And I'll stop there since I've had a significant career previous to that, but not in academia. So
got it.
Hopefully that gives the audience some sense.
Thank you. Well, let's talk a little bit about your experience with integrating quality and safety into these academic programs. So why do you think it's essential to do this? What's your perspective on that?
So I think it's important to realize that we've always in academia had healthcare quality and patient safety theories and concepts in our academic programs. But what's really changed or come to our realization through a lot of research is that while we've been very successful in teaching the theories and concepts, making sure we could help students transition that to having the competencies related to their readiness to join the workforce is where not only the NAHQ research has shown that we have a ways to go, as well as the work done by AACN, the American Association of Education, Colleges of Nursing, has demonstrated that we still have a lot to do. So the framework you've talked about throughout this session, and the material that I've used, which we'll talk about a little greater, really enables us to help advance healthcare quality, patient safety, competencies. So our workforce, those that are graduating, are more ready to practice. It was interesting. I was listening to the president of UMass healthcare system, the university system, on his 2025 State of the Union address. And he talked about the need to make sure we have workforce readiness. And I thought, that is so well aligned with what we're trying to do.
We talk about that all the time, right?
We do.
Yes.
We do as an organization and in academia. That is the new focus.
Yeah, absolutely. And it's interesting because we talked a little bit earlier. I mentioned some of the, the CPHQ and some of the HQ Essentials book and HQ Solutions book I talked about. What are your thoughts about effective ways that these institutions can embed these types of concepts into their curriculum?
Couple of concepts. First of all, I think it's important to realize we're talking about the discipline of healthcare quality and patient safety, not just the profession, those of us that are actually healthcare quality professionals, through various credentials we've earned and experience. And it's important, regardless of the student we're preparing for tomorrow, whether that's a physician assistant, a nurse, a pharmacists, it's important to have them also ready with these concepts and these competencies. What we've traditionally primarily done is use more of what's called summative type assessments. Summative meaning that they're assessments that we have more at the end of a course to evaluate whether a student has learned the theories and concepts. For example, a major final paper, a major quality improvement project. But when we apply adult learning theory and we realize we need more formative assessments, where we're providing those to the students, various assessments throughout the 13 or 15 weeks of the course. So the students can also self-assess, and we can self-assess whether they're gaining the knowledge, skills, and competencies related to the key concepts throughout the course. And that's what I found so exciting about the HQ Solutions textbook, as well as the CPHQ modules, because it allowed me to introduce those throughout the course, particularly the CPHQ modules, which I would have the students take the different modules every couple of weeks in the course. And it allows them through the very interactive case studies that are there to see how well they've gained the competencies to apply it to the cases. And the cases in the CPHQ modules are across the lifespan and across various healthcare situations. So the students self-assess, they gain a really good understanding of where their strengths are, areas they need to study more on, where they may not have gained the competencies or the critical thinking needed to apply the concepts and theories to that patient case study that was in the CPHQ module. And as faculty, I would get a report sharing that with me so I could follow up with each student, providing them more resources, more information, reminding them or sharing with them how the HQ Solutions textbook had a specific section on that concept that they could go back and refer to. So that's how I used those more formative assessments and included them throughout the courses that I've taught at GW.
I love that. And and since everything I mentioned earlier in the webinar, that everything connects to our framework. And so the CPHQ outline, which I talked a little bit about, as well as the HQ Solutions book, are all aligned to the 8 domains. What kind of feedback did you get from the students as far as kind of how you introduced some of that in the formative assessments you just talked about? What was some of the feedback?
Okay. So as most in organizations, we all have final course evaluations that students complete on the course itself, the content, the faculty competency, what they've learned. And I had many students who actually wrote in the final course evaluation that they found the HQ Solutions textbook to be one of the most valuable books that they had throughout their program, and one that, quote, they intended to keep as a really good reference. So several students, as I said, shared that they found it an excellent reference. Not only is the content well aligned with what has become the major core domains of healthcare quality and patient safety, whether you're looking at the essentials that the AACN has released, or if you're looking at our own work at NAHQ. The book covers them really well, provides the students excellent examples, and the references online as well as publications that's listed in the back of the textbook are excellent references for students, particularly when they're doing that final summative assessment, whether that's a major quality improvement project or a major case study or a major DMP project for the students to be able to use. So I wasn't surprised at all when I saw in writing from students that they felt this was one of the most valuable textbooks they had.
That's great. And we hear all the time that, I mentioned earlier that, this book is great at part of our prep resources, but that many individuals and students use this as a reference book, and they go back to it and grab a tool and say, oh, you know what, I need to do that plus delta, or I need to use that other tool. What context am I using this in? And so it's a really great book. It's really one of the only really comprehensive quality and safety books on the market. So that's awesome. I love that. So what advice do you have for faculty looking to integrate this resource into their curriculum? How did you get it approved and start working with NAHQ on this?
Well, I can share the approach at GW, particularly in the School of Nursing. But again, every faculty member listening to this, they will have to follow their own process and procedure, particularly related to their curriculum committee requirements. In some instances, you can simply add a textbook to a course. In other instances, you have to resubmit the entire course syllabus to the curriculum committee. So we'll just state that needs to be individualized and put that over there for the moment. In my instance, what I did was making sure that I could crosswalk the course learning objectives, the weekly student learning objectives, the SLOs, to the specific material either in the HQ Solutions textbook or the CPHQ modules. And I literally created a crosswalk that demonstrated how these type of assessments would help support the students' continuous learning, again, that formative approach at specific weeks, and how well it aligned to the weekly learning objective as well as the course objective. The other thing I did, since I have primarily been faculty in the School of Nursing, was I crosswalked it to the new AACN Essentials document. And there is an incredible alignment between several of the domains in the document where we're required to make sure we can actually demonstrate that we have assessments to measure the student's ability to master the competencies with what's in the HQ solution and the CPHQ. So that became grounding documents or foundational documents and material to present to the curriculum committee to be able to incorporate these type of assessments into the course. Now, needless to say, there are other assessments that I had in the course also that we all tend to use, whether that was journaling, periodic journaling. In many instances, we're using simulation also, whether it's virtual simulation or actual in-lab simulations, immersion experiences, etc. So there are many different approaches. What I found particularly valuable to share with the curriculum committee is also when you think about adult learning theory and how it informs us that we all learn differently. So some students are more visual learners. Some of us learn better through auditory mechanisms. Some of us learn through reading. And what's really nice about these two, whether it's the HQ solutions and or the CPHQ modules, particularly the modules, provide the ability for students with a variety of learning preferences. Since it's a visual format, there's an excellent audio that goes along with it. It's aligned with the readings in the HQ solutions. So it helps to advance adult learning theory in the type of assessments we're using from a formative approach throughout our course.
Great. Well, thank you so much. That's great. And I would think that, like how you mapped it to the nursing standards, I'm sure that anyone listening to this that has, pharmacy and other, clinical, types of degrees, whoever is doing that could also, there could be definitely overlap in some of the performance and process improvement, data analytics, some of the strategy and leadership is my guess. There definitely can find those connections in pretty much any of the other disciplines as you're thinking about integrating that quality and safety into those other examples.
Absolutely true. Yeah. But that's usually the type of material that a curriculum committee is looking at to really understand how you assessed making these changes in your course syllabi. So that becomes some of your foundational material to help the curriculum committee understand why you're taking and adopting these material. There's always external accreditation requirements and standards that all healthcare programs need to abide by. So that can be the foundational crosswalk that you use, similar to how I use the AACN crosswalk to the essential documents.
Great advice. I love it. So what additional resources or support does NAHQ offer to academic institutions? Do you know this, or you want me to take that one? You might know.
Well, it'll be interesting to see whether I do know it or not, Jen. Being a member of the NAHQ board.
Right.
So actually, when I started this endeavor at GW, I was not a member of the board, and I think that's really important, so that from any conflict of interest. I was a faculty member at GW, and I was a member of NAHQ, but I had no involvement beyond that. I wasn't on the board, I wasn't on the finance committee or any of the committees. But I became exposed to the material attending the various NAHQ conferences and educational sessions, which leads me hopefully to answering your question, which is NAHQ as an organization has many excellent educational webinars, some that are free to the general public and some that are specific if you're a member of NAHQ, some that are required and excellent sources for continuous learning for those of us that are CPHQ, have achieved the CPHQ designation. So that's one place to start. The other place to start is to simply call NAHQ and speak to some of the excellent staff that works at NAHQ and individuals like yourself to understand what are the materials and the opportunities that are available for. The other thing I want to make sure I mention, because I should have said this already earlier, when I was negotiating with NAHQ at the time, it was really important for me and for the School of Nursing at GW that when we incorporated all these materials, there was no requirement for our students that they had to then take the CPHQ exam.
Right. Yep.
And that was one way to also avoid any conflict of interest and have the students feel really comfortable. I have to say that many of the students felt that they were well prepared by the end of the course, having been exposed to other course material, the HQ Solutions textbook, as well as the CPHQ modules, to feel that they could sit for the CPHQ exam. Whether they did or they didn't, as faculty, as someone who has a license to use the material, we are not informed, we are not aware. That's between the student and the exam taking. I have had some students that have come back and told me, I passed, I'm so excited, I did do it.
Yeah.
But that's completely at the student's discretion. And I think that's important for anyone listening to this to understand. It can be purely used as another type of a formative assessment to help students advance their competencies in healthcare quality and patient safety, as well as for you as faculty to be able to support the student in their own self-assessment, and then for you to be able to see their self-assessment and provide them additional support. That was a little off topic, but
no, I love it. You answered the question.
Yeah, and I think that was really important to say that. So
No, I agree. And I think some of the, this is really, like we talked about before, about workforce readiness. And for you all, for, the academic, the student experience, the faculty experience, your job is to make sure that you're preparing them the best they can to move into the workforce. And as you get experience and as you're ready to, get additional certifications and all that, that's great. That, people can do that. And we want everybody to get their CPHQ. But the most important thing is that they're being introduced these concepts, this curriculum to the industry standard earlier in their academic work, right? Whether it's undergrad or graduate school, that's really my discussion earlier about sort of why quality is important and how it's being achieved. That connection to having people introduced to those concepts earlier and actually coming into the workforce with a common language, that's what I mentioned before, why it's so important for you, people like you and other faculty who are engaged in this work, really starting to share that not only is all these resources available, but there's also a professional home and a way to continue your education in this discipline of healthcare quality once you get into the workforce.
If I could pick up on one of the things you just said a little bit, Jen, for a second. The published research, not only the research NAHQ has done, AAC has done, and many other scholarly researchers, has really illustrated that we still have significant variation in our healthcare workforce related to healthcare quality and patient safety. And you can see that in our national outcome results. We do not lead the pack as a nation whatsoever in terms of achieving best in class benchmark performance across all the indicators. There's a few, but most of them we don't. And it's that variation in understanding healthcare quality and patient safety, the variation in the competencies in the workforce, whether you're a physician or a nurse or a pharmacist or an X-ray tech. We know that variation introduces waste, inefficiencies, ineffectiveness, and leads to poor outcomes. So this whole movement to advance competencies that are standardized across the workforce is really what this HQ Solutions helps us do, CPHQ, as well as the new requirements from many of the accreditors like AACN to really help standardize the competencies. So as the president of UMass so eloquently said, we have achieved workforce readiness, but across the workforce.
Yeah. Well, I love it. Well, as I mentioned earlier, we are on a movement. I love the idea of a movement, and NAHQ is hopefully leading the charge. So I have one last question for you before I let you go. And you've been so gracious with your time. This is a little bit more on a personal level versus, to share some of your comments about this. But I wanted to ask you, what are some of your other go-to resources for keeping up to date in the profession and discipline of healthcare quality, not including NAHQ? What are some of your other go-to resources, and what would you recommend to your students on, how do you keep up?
It's interesting. I actually do recommend to my students at the end of the semester how the competency journey is a learning journey. I'm not sure it has an end. And hopefully it doesn't have an end, and we all continue to advance our competencies, particularly as the science of healthcare quality and patient safety continues to evolve. Just think about the introduction of AI, which when I was a brand new nurse a couple of years ago, we're not going to get specific, there was no such thing as artificial intelligence or generative AI or any type of AI associated with electronic medical records or CPOEs or anything like that. So we owe it to ourselves to try to stay as informed and ready as possible. Along those lines, in addition to staying active on a couple of healthcare boards and local community boards, staying involved in writing, I have co-authored a book chapter on healthcare quality and policy that should be coming out hopefully later this year. I find that there are several excellent listservs that I get downloads from on a biweekly basis. So the CMS listserv, in addition to AHRQ's listserv, the Commonwealth listserv I find really valuable. So I use those also, as well as some scholarly journals to try to keep myself current and active, as well as, participating actively in the field, particularly as it relates to nursing. So I'm on a couple of nursing board advisory councils and still very involved in SIGMA, which is National Honor Society. But the point is, to answer the subset of your question, whatever your profession is, there's a discipline related to your profession. And that's what you need to try to stay current, to push yourself to really stay informed and engaged, to really continue to force yourself to expand your learning and your learning opportunities. So hopefully that addressed your question, Jen.
It did. Thank you so much, Esther. I really appreciate your time today. And I'd also really like to thank Jones and Bartlett Learning. They've been an excellent, excellent partner as we began the journey of creating HQ Solutions, the 5th edition. And they've just done some great work. And we're really excited that we've partnered with them, and thanking them again for being part of this webinar. So we'll leave you with that. And we appreciate all of your time.
Thank you.